So we have Andrew here from TestCard. We're going to be doing one of our new formats, which is product demo. So thank you so much for being on our first product demo, Andrew.
No problem.
Would you be able to give us an overview of what TestCard do?
Sure. So at TestCard, we've embedded a urine diagnostic device into a postcard, which allows people to diagnose common conditions in the comfort, convenience, and privacy of their own home. This particular test is a test for urinary tract infection, and yeah, that's what we're going to be looking at.
Would you be able to showcase your technology and your product? Would that be okay?
Sure. Yeah. So this is the app. And you want me to do the demo?
Yes, please.
Yeah, sure.
Yes.
So I've got a glass of water here.
Yeah.
So this is our stand-in for urine in this case.
Yeah.
So the first thing is use the app and it tells you what you're going to be doing. So you start the test. So we're going to get ourselves out a test strip, as it says there. These are individually wrapped, so they get around 2 years of shelf life out of that.
And did you say they're wrapped in foil?
So that's a little foil envelope.
Okay.
There. So, and then when you take these out, this is what they look like.
Yeah.
So the first step here is it's telling you need to scan the QR code. So we'll scan that, and that controls for the type of test it is. So the phone knows now it's a urinary tract infection test. It controls for any expiry date and lot-to-lot information. It's also unique, so this QR code doesn't appear on any other test. So it stops people reusing it, but also means that we can share the results back to where it's supplied from. So if it's supplied from a particular location and the user wanted to share those results directly back with that healthcare provider, they can.
That's amazing.
So next step, it's saying dip the test.
Okay.
So I'm going to dip it and indicate that I've dipped it.
Yeah.
And then it's just a matter of waiting the period of time to allow it to develop. Now this is the demo one, so I'm going to skip it forward for you so you don't have to sit there. And when it's ready, it does a little flash. And it's a matter of just lining it up.
Okay.
And there we are, it's captured it.
Brilliant. And so this technology is currently being deployed in what countries? This is for urinary...
So this is urinary tract infection, so this is our first product on the market in the UK.
Yeah.
So we're expecting our CE mark in January.
Okay.
And that will be followed up with expansion then into Europe as well. And this will be going for FDA approval in late spring, early summer next year in the US.
That's incredible, and it's that easy.
Yeah, the results are ready, just need to agree to the terms and conditions there. You can see it's negative. The glass of water does not have a urinary tract infection, as you would expect. And you can see it actually just gives them a take-home answer. It says you don't have that. Here's some guidance about what the next step is if you do. But under more information, we can look in here and it gives them a breakdown of all the individual results it's used to generate that result.
Okay.
So that's something that they can share with their healthcare provider if they want to.
That's really interesting. And during our podcast previously, you mentioned that the foil and the wrapping is really important because it enables you to increase your shelf life. I mean, would you be able to kind of talk about that?
Sure. These particular strips, they're moisture sensitive. So if you even just leaving them out on the table for a couple of hours in this room, they'd actually go off. And it's one of the problems actually of delivering this sort of dipstick testing even in clinical settings, but in homes, is people buy the strips or they're bought or they're used in clinical settings and they don't realise just leaving the cap off for a long period of time, even while they're using it, can make the strips completely useless. So the results they're getting aren't actually correct.
Yeah, that's incredible, and it's that easy.
It's that simple, yeah.
Wow, brilliant. Well, I really appreciate you for being on our first segment, our first product demo segment. So,
no problem.
Is there anywhere people can find this?
So like I said, until our CE marks through, we can't actually make it available because it is a diagnostic. So it'll be in January that we're expecting our CE mark through.
At some point in January. Is there anything that is in the market right now on your website?
I think we have some pre-orders available for our drugs of abuse screen.
Okay. That's interesting. Drugs of abuse.
Yeah, so we did that as a proof of concept to our investors, showing how we can multiplex, effectively do multiple tests simultaneously, and it tests for 10 different drugs of abuse and delivers back a take-home result directly. So that's one of the ones we did just to sort of prove that we could as much as anything else.
That's incredible.
Although there's a lot of interest in that test within the US with the current opioid crisis going on.
And do you envision having to being able to distribute that to like a police force in a country sometime?
Well, we want to be a healthcare company, and we're not here to sort of catch people out. That's not, that wasn't our primary interest. Our primary interest is actually progressing healthcare and allowing people to access healthcare and empowering them in that. The drugs of abuse thing was really as a proof of concept because it has much lower regulatory threshold in this country than the diagnostic does.
That's amazing. Thank you so much for being on our show.
No problem at all.
Take care.
Thank you.